get a comment from Adeloop, which we kind of shared with you guys a little bit earlier. But again, the car score doubled overnight. It's now
162.6.
162.6. And so what we want to do here is to provide a little context about what the car score is, what many of us have been led to believe it represents, by taking you back to the beginning. Is there any other better place to go? So we're going to go all the way back to November of 2020, and we're going to start with the Adeloop Communications Director, Crystal Paco San Augustine, kind of explaining exactly what is the car score.
So maybe we should just go back and define CARS score for some of our viewers at home. Again, the CARS score stands for COVID Area Risk Score. It's a tool developed by our local physicians, really authored by Dr. Felix Cabrera to help us determine our COVID risk. So it takes into account the incidence of new cases, how well our testing identifies these new cases, and as well as the rate of spread. And so this score helps us to determine our COVID risk. Basically, the lower the score, the better our ability locally to manage our COVID risk, and the higher the score, the more we are testing those maximum limits of our public health system and our hospitals. So what you saw a few weeks ago when our CARS score was in the 40s was we were putting out we had to do extraordinary measures to help manage our COVID response. The Blue Med tents had to be assembled. We've had to, call on our military counterparts to help supplement or augment our staffing in the hospital. We have the New West nurses that are helping us. And so the lower the score, the better we're able to manage. Locally, we're able to manage. We're not testing our limits. Public Health and GMH and GRMC and Naval Hospital are able to manage, their workload as well. And so in response to
And then we'll go ahead and play Dr. Cabrera. He is the author, the inventor, if you will, of the car score. Dr. Felix Cabrera, kind of going in a little bit more on the explanation, defining what the car score
that
is.
we want to think about. And then Crystal also had a really good analogy of also thinking of a score like your credit score. There's a lot of math behind it. You can kind of understand a little bit about what those factors are, but in the end, it's the score that really matters, and it's easier to follow. So that's where the COVID area risk score comes into play, or in other words, CAR score. So some of you may remember that the CAR score was used in the summer, primarily for how we risk stratified travelers that were entering to Guam into what quarantine protocol they were going to end up going into. And the CAR score was meant for non-Guam areas, and what their score was, so that we can assess the risk of these different areas. So now we're actually using it to assess ourselves. We always kind of track where we are relative to the rest of the public, but this now is really focused, and in all honesty, this is the third version of the CAR score. But ultimately, it just takes into account the incidence of new cases that we're seeing, and how well our testing identifies these cases, and then also the rate of spread. And you take those three into account, and then you get a good sense of where we are in this battle. Okay, so.
All right, and so Jay, what you had learned was that they said they kind of modified the CAR score formula because apparently it doesn't reflect the hospitalizations.
Yeah, so you heard Dr. Cabrera right there, and that was kind of consistent with questions that we asked him about a year and a half ago, where he said the current version of the CAR score at that time, like probably about 18 months ago, was the third version. You heard him say as such.
CAR score 3.0.
Yeah, like to the best of our knowledge, it hasn't been like updated since, and obviously, there've been at least two major variant strains of the initial virus. Obviously, there's things with the hospitalizations. But Joe, you got that graphic if you can? And so Joe starts popping up the graphic over here, and again, by design, the CAR score says on this thing takes into account 1, incidence of new cases.
Yeah.
2, how well testing identifies said cases, and then 3. The rate of spread throughout the community.
And so if you take those three factors and what they mean, and you look at the CAR score being 162.6, it makes sense because we have a high incidence of new cases. The testing is identifying these cases, what testing we are doing, and the rate of spread is just insanity. At
the time when Crystal was making that announcement for the first soundbite, She was saying with the CAR score at the time, she said at its current level of 40.
And that we were in danger of stretching the hospital and our public health
Yeah.
system.
Just put it into perspective. We're now 4 times that.
Right. But what
I mean,
they're
granted,
saying,
that was pre-vaccine, that was pre-Delta, that was pre-Omicron, but still,
Right. Yeah,
the
but
CAR
what-
score in its current incarnation is 4 times that amount.
and what they're saying, though, the difference is the CAR score was used to predict hospital metrics. But that's not the case anymore because vaccinations, boosters, and treatment prevent people from getting severe illness. And so I guess where we're at is I mean, to me, that sounds like they're dressing it down. Like, it's not that important. But most of us were told, like, we just play the videos. The CAR score is the single number that you use to track the pandemic. And so, yeah. Oh, yeah, we have the governor's thought. And so this is, we're going to take you back here to when the CAR score was 40, and there was a big campaign for us to get it down to 5.
I am calling on each of you to strive for 5, to maintain a CAR score of 5 or under for the next few weeks. We do this by wearing our mask, watching our distance, washing our hands, and having the will to do it. My dear people of Guam, we all have a role to play in fighting COVID-19, and our vigilance cannot waver.
Any reasonable person would look at the situation back then and look at it now and see how our government was reacting. It was the whole night and day. We had the governor, we had Crystal Paco San Augustine, had Dr. Cabrera, but now it's Omicron. Super typhoon, we were told, but we just don't see the same kind of response. And I don't know how he feels about the CAR score, but someone we do see a lot of here on the show. We're so grateful to get him on when we do. Dr. Hoa Nguyen, he's the former Physicians Advisory Group chairman. Doc, CAR score, is this something that you look at and reference? Because it kind of seems like I don't know, Dr. Berg doesn't like it. The governor is always referencing it, but now Adelup is saying that even though it is really, really high because we have vaccinations and boosters, we shouldn't worry about it, I guess. It's confusing.
Yeah, I think we should kind of stop using this CAR score at this point. I mean, there's a lot of factor that we currently have that kind of need to do a lot of adjustment for the CAR score, especially, we have a high percentage of people that fully vaccinated already. So I think we just have to follow the rate of positivity in the community and just follow that daily and weekly. And also we have to monitor the hospital. That's all we have to do. But I think the CAR score kind of really throw people off a whole lot. You go from less than 5 to 160 something 7 in about a week to 10 days. It just doesn't make any sense. So I don't like it either.
What do you think it is, though? Why do they keep using it? I feel like it's something as simple as, like, they don't want to look dumb. Like, we made this number, and it's a 1 number, and you got to check this number, and now we don't want to really reference that number anymore. I mean, what's so bad about it? Just say, hey, it's a different time. Like they're saying, oh, it's supposed to reflect this, supposed to reflect that. So 160 doesn't mean the same thing that it would mean, 2 years ago. So if that's the case, then chuck it.
Yeah, I think the time change and as the more we learn about this COVID infection, and the variant change a whole lot. So I think that as things change, we have to change the way we do things, and we got to drop certain things that no longer make sense for us to monitor. So I just look at it and say, oh, wow, but that's it. But the really I'm looking for is the rate of positive out there and also the hospital admission. That's the most important one. And the hospital admission is usually about 10 days, 2 weeks behind. So we need to keep our finger crossed that it doesn't go up because we have triple digit now for at least a week now. So we have to be careful. But I tell you, this is Omicron. It's not the Christmas gathering. This is not the New Year gathering. This is Omicron because we see the infection so rapid out there that it's really crazy. As I tell you on the chat yesterday that, one thing that we have to know, and as a primary care physician and as a clinic that we see lots and lots of sick visit, and we talk to our patient to find out what's going on. It's not from paper, it's not from any type of data gathering, but Omicron will not spare anybody. Unvaxxed, vaxxed, fully vaccinated, partially vaccinated, boosted, recent infection with Delta, it's gonna go right through to you if you drop your mask. And that's what we see in our practice. Everyone we talk to is that there's some type of gathering that they attend and they drop their mask and they got infected. And I tell you, we have to pay attention. I know that people say, hey, the symptom are mild, but if you talk to about 70% of people that we found to be positive in the past week or so, they are miserable. And I tell you, they are very concerned when they have it. So it's just it's when we say about mild, it's what we read. When you talk about people that have the recent infection, they will tell you otherwise. So, so I think the best thing that we can ever do for ourselves to protect ourselves and our family is to wear the mask. Okay, mask work. Okay, and also, if you don't have to go to the gathering, stay away from the gathering. Okay, that's where the super spread is. So just all the gathering, all you do is drop your mask, and I promise you, the highly chance you're going to get the Omicron, you will get it. So just get your mask. Try not to go to any gathering, and get your booster. I know the booster, it won't prevent you from getting Omicron, but at least try to keep the severity low, so the chance you be in the hospital is much less. So so mask is number one, booster is number two. So please do that, and stay away from any gathering. If you can, the indoor, outdoor, it does not make any difference. If you sit by someone and you don't use your mask, you will get the infection. And so, just be careful. We're going to go through this. The number will get higher. So just protect yourself and your family, please.
Doc, can we just go back a little bit? So Friday, Public Health announced that for the testing, and I know that we've talked about testing. We talked about preparing for this super typhoon Omicron. You were the guy who said, hey, they got to make the testing more available. They were doing it 3 hours a week last week. The governor was on our news saying that they were going to increase the hours of testing starting this week. They did, but granted, they did it with an appointment-based system. And so they announced this on Friday. Come Monday morning, total malfunction. Everyone shows up, no clue what's going on, of course, because the messaging is miserable. The public health said, we anticipated this because we didn't tell anybody about it. Do you think that was a good time to kind of switch to an appointment-based system, or should we be trying to make testing easier for the people, not the government? I don't know.
Yeah, I think that, on the middle of upcoming surge, I say upcoming because we just see the beginning. I think that by appointment is not a good thing to do. I think we should make the testing much more available to encourage people to go out and get tested. But but to put appointments, some people they don't take the time to make the appointment, or they're going to delay the test. So I would say that there's different ways to approach this by, there's close contact line, there's a symptomatic line. So you have to devise some different way and just encourage people to go out and get tested, but not by appointment basis. I hope that they don't turn anyone away if they don't have an appointment. I don't think they do turn people away, but I'm glad that appointment are not our testing is much longer now. So thank you for doing that. So they give people time to get that test throughout the day. But I would continue to extend the hours, do 6 days a week, but probably create a different way. Like I say, the one that you're really looking for, the symptomatic one. So rather appointment, just have a line for people that have symptoms. So that way they can get tested and isolate themselves. With the close contact one, more likely, if they most likely be negative, but the symptomatic one, you really catch them. So should be a special line for symptomatic patient.
Doc, I know you kind of talked about what you're seeing at the clinic a little bit earlier, but just in talking to people I know, it sounds like a lot of people are sick, and not
Yes.
all of them are going to get tested to know their status. But just in talking to people, I'm talking to people where it started with auntie, and then the whole family got it, even the kids. You know, what I mean, hearing this like all the time. So, what are you guys seeing and hearing?
Yeah, we have quite a few phone calls of people do the home test that they are positive. I'm not sure those home tests they report that public health or not. There's quite a few of home tests positive there at home, and when they call, we ask them to isolate themselves at home. But regarding sick visit, yeah, I think that the three main clinics, AMC, SDA, and FHP, we see an uptick on the sick visit. Yeah, we'll get into a little bit more problem before we get better, and then I say it's going to take us another 7 weeks to do so. But I encourage people that if they have symptoms, they test negative on the day one. I would recommend that they test again about 3-4 days, because sometimes it takes the second test to turn positive. So don't think that you test negative and then you can go out and drop your mask or socialize people, because you might turn positive in the next 2 or 3 days. So get them retest, keep your mask on if you're sick, and try to stay away from the people if you have a congestion or coughing or sore throat.
Doc, you said, we saw last week it was, 20, 40, 70, whatever, 100, 200, 300 last night. But you're saying this is just the beginning. What can we expect if this is just the beginning?
We expect that to go higher. Hawaii have 4,000 yesterday, the day before. So I think that we will break 400 most likely in the next few days or next week or so.
What does that mean? You say that, and we all know just from experience, having been in this thing for a minute, that the hospitalizations, the severe illness usually takes about 2 weeks, right, to kick in. So what are we going to be looking at with the hospitalizations and all that?
Yeah, it takes about 7 to 10 days or so to get in. I know that most of the admission is not ICU, but I think that we should look at that way, because every COVID patient, again, that admit to a hospital takes tremendous amount of manpower to take care of them, and they take the manpower away from the non-COVID admission. So we like to keep in the single digit if possible, because I tell you, ICU or non-ICU, still a lot of work for the people on GMH and GRMC, and also put the health worker there at risk to get infection also.
How crucial is the monoclonal antibody treatment? And then also, I know that Dr. Bob had said something like they were ordering a pill or something. So just our pharmacological interventions for Omicron, the variant of the virus, how important are those in kind of hammering down this surge, or at least trying to deal with it?
If we were dealing with Omicron, the monoclonal antibody, Genco, does not work as well. But we still need to give people the monoclonal antibody in case if we are still dealing with Delta. So we can't tell the difference. So we have to make sure that we still treat the people that have COVID symptoms that test positive with monoclonal antibody, even if we know the Omicron does not work well and will not respond with the monoclonal antibody. Now there's I know that they are back order on the new monoclonal antibody from, I think, GSK that work for Omicron, also an antiviral pill, but that is far and few right now. I think that we're going to have like 18 doses of the new antibody, and I'm not sure how many doses of the antiviral pill they're going to send to us, but you cannot buy them. Those are supplied by the federal. So whatever the federal government gives to one, that's all we can have. And we can order as many as we want, but they will give a certain allotment, and that's what we can have. And those things, once we have it, we more likely will treat the patient at this point with those antiviral pills. But again, we're still waiting for the genome sequencing machine. Isn't it kind of nice to know you have Delta or Omicron, just because the treatment is different?
Right. Yeah. And it would just save a lot of, I mean, if we know what we got and we know how to deal with it.
Yes. Yeah. But I tell you, Omicron will run over everybody. So, our people need to be very careful. I have a wedding this past weekend that I forewarned the family, but they go ahead and did it, and again they suffer because they turn positive now. So it's just really you have to be careful. You have to be responsible for your event and your guests, because you don't want to lose anyone come out of your event. So wear your mask inside, outside, doesn't matter. Vax or unvax, boosted, doesn't matter. Omicron will run over you. So be careful. Like the governor is saying, keep your mask on. It is an effort for everybody, to keep the mask on and social distance and try not to do much gathering there.
Doc, what about frontliner fatigue? Is that a real thing? Because I know that when I go on Instagram, what I'm seeing a lot of guys. I don't know if you see this. You're not on Instagram, right? What I do see is I see a lot of these like travel nurses. They have these like, I'm a travel nurse Instagram, and they're like, I'm in Guam now. It's so beautiful here. So I know we're still doing the travel nurse thing, right? But
Right.
how crucial is like that frontliner fatigue that I'm reading about in a lot of national news reports?
It's we are fatigued. I can tell you from my staff, they work a lot, and they take a lot of risks. There's the hospital, GMH, GRMC, and they are tired, but they still try. I know that every healthcare system, including GRMC and GMH, and even our clinic, we do lose some critical healthcare provider already, just because they have COVID. So when you come in a shortage manpower and you have to take care of a surge of non-COVID patient and COVID patient, they're gonna be very tired. So sometimes they kind of short fuse and treat you not as nice. Just to understand that they've been through a lot. So it's been 2 years already, and they keep facing the same problem every day. So I would say that if you see the healthcare worker, just be nice to them and say thank you for what they do. Because I tell you, they go through this every day. You get sick with COVID for a week to 10 days, you get over. But these people, they're dealing with COVID every day in the past 2 years. So my hats off to all of them, and thank you for taking care of the patient.
Thank you, Doc. Appreciate it.
But the one thing, Chris, you have to be reading the isolation quarantine new guideline very carefully. I hope we'll talk to some of the PAC members, try to change a little bit. But right now, I'm very confused. And as I told you before, when this Omicron hit, you have to have a very clear, simple guideline for isolation quarantine. And right now, that isolation quarantine, when I read it last night, I said, wow, it's very confusing.
Yeah.
We are to a hybrid system. We didn't follow CDC guideline completely. And we to a hybrid that's very confused for the provider, very confused for public health and the normal people to really look at that and say, wow, where am I fitting to this thing? So they need to kind of simplify the isolation quarantine guideline.
I was looking for it, Doc. Yeah, I agree. It's something like if you're unvaccinated, touch your toes, turn around 3 times, and then go to your room and look at the ground with a mask on. And then if you're vaccinated, it's confusing. You're right.
Yeah, so the CDC say that, you have a vax, unvax the same, 5 days, and you can do that. But no, this, our guideline really, you go to from symptomatic or asymptomatic, and you break down to the
Basically, Doc, when I read the guidance, it's like I got to be a doctor to figure out which freaking isolation protocol. So I need to decide if I'm asymptomatic, and then I choose my own adventure quarantine. That's what it reminds me of, Jay. It reminds me of choose your own adventure.
Okay, so just for right now, just be safe, guys. When I say Omicron won't spare anybody, but mask is number one and booster number two. So you gotta get those two to get you out of trouble. Okay.
Doc, just before you go, so I know I've heard from you and just a few other people, even from people who have traveled here with their negative test, yet the next day they're testing positive, right? And so you can only assume that they're coming back with COVID, but they're not. The test is not catching it because of that whole testing window thing. That being said, do we need to do more to like stand up the walls around us with the quarantine, like you said? Because I mean, with that guidance, it's like I would just pick whatever option means I have to isolate the least amount of time.
Yeah, I discussed that a little bit with a few people, and what we see in the clinic, right, is basically what we see is what we get here is that quite a few people that come in off island turn positive a day or two when they get here, and they're symptomatic. All of them are symptomatic. That's the reason why they come in and get tested. And so, and they have a negative test coming in for the unvaxxed. For the fully vaccinated, remember, they don't have any tests when they come in from the state, okay? So, but 1 or 2 days when they get here, they have symptoms, even they have symptoms before they board the flight to Guam, okay? And they come in and get tested positive. So, but no, when we fill out this application on the flight about what seat number we sit at, and we have symptoms, I know we turn that into public health, but don't know if people that turn positive, any way that public health can track them, that once they're positive, they know what seat numbers or can do the contact tracing, people that sit around that person. Because I know when I flew back like a week or 10 days ago, I mean, there's like 10, 12 times that the flight crew had to remind people to put their masks on, so I hate to sit next to someone that's coughing. My daughter get back 2 days ago, and she said, well, there's a guy sit a few rows from her, they're coughing like crazy in the plane. I said, wow, I need to just move to a different seat, so we gotta be careful. We gotta do some way to track the incoming if they turn positive. And I'm not sure we have a way to do that at this point.
Yeah, I know someone who actually left the island, and when they landed, like 2 days after they landed at their destination, they got a notification that someone on the flight had tested positive. So what do you even do in that situation? Are we even contact tracing anymore? I don't know, Doc.
At this point, it's when there's so much positive, I think that they probably contact tracing on the main event, just like a wedding or some type of gathering. But if you're going to have a house that's positive, I don't think they're going to chase after that because the manpower is not there.
Thank you, Doc.
You're welcome, guys. Just be safe, please, and wear your mask, okay? And you don't have to go to any rosary or wedding. Try not to, because we all have to do our part, okay?
Thank you, Doc.
You're welcome, guys.
All right, Dr. Hoa Nguyen. Hate to say I told you so. Right, Doc? I hate it when he's right, man. But he did say we need to ramp up the testing because Omicron is coming. It's just a matter of time. And here we are. At the beginning of what he says is probably for sure an Omicron surge. It's 8:58. We're going to take a quick break. Senator Sabina Perez is coming up right here on the link.